Good morning, friends. I am Dr. Sainath. I am a consultant medical oncologist in Care Cancer Institute, Care Hospitals, Banjara Hills. So today I will be talking about chemotherapy in cancer patients in the times of COVID-19 pandemic. COVID-19 pandemic has changed the way we are treating the patients. Cancer patients have lot of immunosuppression, are immunocompromised, so they have a slightly higher risk of severity of illness with COVID-19. So the most common doubt which we face from the general public is it safe to take chemotherapy in COVID-19 pandemic, or can the chemotherapy wait? So it depends upon the kind of situation, and on a case to case basis we can decide should we give chemotherapy, can we postpone chemotherapy, or is there any better alternative. Is given in two conditions. One, in an adjuvant setting where the intention is to decrease the risk of relapse in a cancer patient. If a patient has a high risk of recurrence of the cancer, in such patients should not avoid chemotherapy. So what are the precautions one can take if they have to take chemotherapy? So if a chemotherapy is contemplated, the prior blood investigations, consultation, toxicity evaluation can be done on a teleconsultation basis, and the chemotherapy can be given in a predetermined time slot, thereby decreasing the hospital duration stay and decreasing the number of hospital visits. Now the complications of chemotherapy can also be managed home based depending upon the severity of the symptoms. So based on the symptoms, if they are mild and can be managed at home, a teleconsultation and the required treatment can be given at home. If the patient develops some danger signs because of chemotherapy, which you can always talk to your medical oncologist, you can come to the hospital. So by decreasing the hospital visits, maintaining social distancing, masks and sanitization, we can decrease the risk of COVID-19 infection even while you are on chemotherapy. The second situation in which we do prescribe chemotherapy is in a stage 4 disease, where the intention of treatment is to improve the quality of life of patient and prolong survival. So in a patient who is otherwise fine but has a stage 4 cancer, we should be giving chemotherapy, but we will be looking for the drugs, regimens which will cause decreased immunosuppression, which if preferably if they can be given orally, thereby decreasing the contact with the healthcare provider and decreasing the hospital visits, and if possible going through a teleconsultation. So every cancer has a different kind of chemotherapy regimens. So it is preferred that if it is possible to give the chemotherapy in a single day, to avoid a multi-day regimens, if it is possible to give it orally, or if there are any alternatives, targeted medications to a specific cancer, which you can discuss always with your medical oncologist. So in patients where these alternatives are present, it is safe to take all these medications and be under constant follow-up with your medical oncologist. In certain situations where the patient has completed chemotherapy and is in some kind of a maintenance therapy, like patients who are on oral chemotherapy drugs or patients who are on hormonal therapy, these patients can safely continue their treatment without an increased risk of COVID-19. The another general precautions which one always needs to take is to mask up properly, to use hand sanitization, and also maintain physical distancing. A patient with cancer generally would have lot of well-wishers who would want to see him, talk to him and give moral support. All of this, if it can be done virtually, it would be well and it would be good. Try to decrease the number of visitors to your home or to the hospital if you are admitted, thereby decreasing your chance of COVID infections.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.